Welcome to our channel. Please subscribe and like this video for more intriguing medical content. Today we're diving into the fascinating world of genetics to explore a condition known as sickle cell anemia, a disease that alters the shape and functionality of our red blood cells. Picture the typical red blood cell, round, soft and flexible, smoothly navigating our body's highways and byways, the blood vessels. Now envision this cell distorted, its round shape twisted into a rigid sickle-like form. This is the reality for those with sickle cell anemia. These misshapen cells can cause a host of health complications, from pain crises to organ damage, as they disrupt the smooth flow of blood. This condition is not caught like a common cold. It's a genetic disorder passed down through generations. Understanding the nature of this disease is the first step to managing it effectively. Sickle cell anemia doesn't just happen. It's a result of specific genetic mutations. It's like a clandestine operation happening right inside our own bodies. When it comes to sickle cell anemia, it's all about the genes. Specifically, it's inherited when a child receives two sickle cell genes, one from each parent. Imagine a relay race, where each parent hands off a baton. In this case, the sickle cell gene. When a child ends up with two such batons, sickle cell anemia is the unfortunate result. But what about those who receive just one gene? Well, they're known as carriers. They don't have the disease, but they can pass it on to their children. This genetic inheritance makes prevention a challenge, but understanding it gives us a path to potential solutions. Knowledge, after all, is the first step towards finding a cure. Sickle cell anemia presents with a range of symptoms that can significantly affect a person's quality of life. One of the most common symptoms is fatigue. This is due to the shortage of red blood cells, also known as anemia, which can make you feel tired and weak. Another symptom is jaundice, a yellowing of the skin and eyes. This occurs when sickle-shaped cells break down at a faster rate than the liver can process, causing a buildup of bilirubin, a yellowish substance in the body. Pain crises, also referred to as vaso-occlusive crises, are another symptom. These are episodes of pain that occur when sickle-shaped red blood cells block blood flow to the chest, abdomen, and joints. Lastly, individuals with sickle cell anemia are particularly susceptible to infections, as the disease can damage the spleen, an organ that helps the body fight off infections. While these symptoms can be severe, they vary greatly from person to person and over time. Although there's no cure for sickle cell anemia, it's possible to manage the symptoms and live a full, productive life. Let's delve into the strategies to manage this condition, starting with medication. Hydroxyurea, for instance, is a drug that can reduce the frequency of painful crises and the need for blood transfusions. Blood transfusions are another management strategy, replenishing the body's supply of normal red blood cells to improve oxygen delivery. However, frequent transfusions can lead to complications, so they are used sparingly. Lifestyle changes also play a crucial role. Staying hydrated, avoiding extreme temperatures, and getting regular exercise can help prevent sickle cell crises. It's also important to maintain a healthy diet and get plenty of rest. Psychological support is equally vital. Living with a chronic illness can be emotionally taxing, so counseling or support groups can be beneficial. Effective management of sickle cell anemia requires a comprehensive approach that addresses both physical symptoms and psychological distress. Sickle cell anemia is a complex disease, but understanding it can lead to better management and quality of life. Let's recap what we've discussed. Sickle cell anemia is a genetic disorder caused by inheriting two copies of the sickle cell gene, one from each parent. This mutation results in red blood cells that are rigid, sticky, and crescent-shaped, like a sickle, causing various complications. The symptoms can range from mild to severe. It's not uncommon for individuals to experience episodes of pain, fatigue, and shortness of breath. Additionally, the disease can lead to complications such as infections, delayed growth, and vision problems. Managing sickle cell anemia is multifaceted, involving regular checkups, vaccinations, pain management, and even psychological support. It's essential to remember that early diagnosis and comprehensive management can significantly improve the quality of life for those living with this condition. Remember, knowledge is power when it comes to managing sickle cell anemia. Thank you for watching, and don't forget to subscribe and like this video for more medical insights.